I'm going to get started because we've got a lot to get through again today. So hopefully a lot of you went away and did some kind of pilot testing of the intervention, whether that was on the tablet or on a paper version of the intervention. What the kind of main learning objectives today are. So last week we went through kind of an introduction to the intervention and how to navigate it and did some very brief skills practice. Today is more about reviewing and refining those skills, but then also reflectively exploring the difficulties and barriers that you encountered between last session and now, but also the good things as well, and kind of reinforcing those things that you feel will be of benefit to you in your work and also of benefit to the people that you care for. So what I wanted to do is to kind of put our reflexive hats on today and be much more kind of introspective and thinking and being honest with ourselves and the others in our rooms and thinking about what some of the issues are that we might encounter. And that could be anything from technology issues, lack of confidence, just a complete kind of dismissal of the intervention itself and not thinking that it will work with certain people, you know. So it's just about kind of being really honest and reflecting on those things. And then next week, we'll think more about kind of the clinical systems and the implementation within routine care and how we can address those. But today it's kind of all about you as a clinician and about your practice and how Dialog Plus fits with that. So I'm just going to quickly over, oh God, I've done this wrong. I'm going to go over the Dialog Plus intervention again, and this might seem repetitive, but it's just to kind of embed everything that we did last week and as a reminder, because people have slept since then, about what Dialog Plus is and what its purpose is, and also just how to do it, how to go through the process from beginning to end. So just as a reminder, there are two main parts to Dialog Plus. There is the first section, which is the dialogue scale. And the dialogue scale is an 11-item patient-rated quality of life measure. And what this does is it does two things really. It collects routine outcome measure data, but then uses that outcome measure data as part of the therapeutic intervention, which leads into the second part. So this isn't just about collecting outcome measure data for the sake of it, that is stored away in a file somewhere and never referenced or never referred to or never used as part of the conversation. What the dialogue scale is there to do is to collect information, which is really important. Like, we can't underestimate the utility of outcome measure data and scale data. But then also the Dialog Plus intervention as a whole gives you a process to integrate that in part of the care planning, but also just as part of the conversations that you have with your caseload and with your service users. So that's the dialogue scale. We'll go through it now. The second part of the intervention, this is kind of the more therapeutic part, is the 4-step approach. And what this is it's a stepwise process based on principles of solution-focused therapy, because basically we need, for any kind of intervention, you need an underpinning therapeutic model to kind of explain the mechanisms of change and why we're doing what we're doing. And the principles underpinning this are the solution-focused therapy. But this 4-step approach integrates that dialogue scale data into the conversation and then allows a kind of a wide-ranging conversation about satisfaction and quality of life, which then feeds into these action items which are set, which then become the care plan that is created over time as more and more sessions are done. So these two parts of Dialog Plus are separate but also interconnected. So you definitely shouldn't see it as kind of just like this tick box exercise where you collect the scale and then you do the 4-step approach and have a conversation. These two things interrelate with each other and you can't do one without the other really. So dialogue scale, just as a quick reminder, an overview, it's in 11 items, all asking about satisfaction. So how satisfied are you with your, and then you just complete the sentence with these 11 different areas. The top 8 are life domains. So these are kind of subjectively rated areas of their life that only they know about and they're the expert on. And then the 3 at the bottom are patient reported experience measures, or PREMs, and these kind of rate satisfaction with the service that they've received, and the relationship that they have with you, and the service as a whole as well. So each of these 11 items is rated on a scale from 1 to 7, 1 being totally dissatisfied, 7 being totally satisfied, and they can, you know, go anywhere between those numbers. And also, after every question, it's really important that we say, do you need more help in this area? To empower the patient to set the agenda and to say, this is kind of what I want help from you with. So just just put these kind of tips or strategies in, and these are based on kind of the frequently asked questions or the frequently encountered problems that we get from clinicians across both the UK and globally. Often the problems are the same. So we often get asked kind of, what are the definitions of these 11 areas? So what does practical help mean in this context? Or it says partner/family. What about if they're satisfied with a partner, but their family is a nightmare and they're having really issues with that? So we are very loath to give prescriptive definitions of these 11 areas. And what we always say is that these should be kind of within the interpretation of the individual patient. So what does practical help mean for them? What does accommodation mean to them? Because these things are so variable across the context of patients' lives. It might be that accommodation to one person is very different to accommodation to another person. So we can't set these kind of very strict prescriptive definitions for the areas. They are kind of flexibly defined by the relationship that you have with that patient. Yeah, and they don't necessarily need to be kind of consistent across the patient either. What the areas mean for that patient can change over time, and that's absolutely fine as well. And we should be adaptive to those changing contexts. And just as a little tip, always remember to answer the "do you need more help in this area" question on the tablet, because the app will not allow you to move on to the next rating until that question is answered. And a lot of people are like, why won't it let me move on? The app's broken. And it's just the fact that they've not answered the "do you need more help in this area" question on the tablet. So this is what the intervention looks like on the tablet. You can see the 7-point Likert scale there right at the top, totally dissatisfied, all the way to totally satisfied. And the question is, how satisfied are you with mental health? So it's a very simple outcome measure, same scale for every item. And it's literally just about going through this question by question with the service user and encouraging them to answer it using their own knowledge and experience. It usually covers around kind of the past week, but it could be as kind of the timescale could be as little as that day. So kind of, how satisfied are you with your mental health today? Yeah, and if you're doing it on the tablet, which we encourage, it's really important that you kind of include the service user in that process and sometimes give them the tablet to fill this out, and you know, sequentially move down the scale until all of them are answered. Once all of them are answered, you get this overview of all the ratings. And I think this is often underused actually within services for those who use it, because this is actually really clinically insightful to see how these different areas compare against each other. So you can see why is it that they're completely satisfied, they're totally satisfied with their partner and family in this example, but the job situation is so low. What are the differences between those two items that are causing such difference in satisfaction? And it's just really interesting to kind of compare within, but then also across sessions as well. So a feature of the tablet is that the orange box, you can click on the dates on the top and that turns them orange. And then the orange lines denote previous ratings given on these different areas. So you can also compare a bit kind of between sessions and see kind of the change in satisfaction and how that has changed. Has that increased? Has that decreased? And what are the factors or reasons underpinning those changes? And even just asking a patient to kind of reflect on that and think, well, what has changed in my life that has caused this shift? Can can open up understandings of resources that are available or that they have that they didn't realize had such an impact on their satisfaction or on their quality of life. So the comparison feature is really important. And like I said, it's often underused. So it's important that you as a clinician conduct an overview of all the ratings for that session. So compare the blue lines, but then also use the orange lines to compare across sessions. Just note that you can only compare the current session with one other previous session. So you can't compare like two historical sessions. It's only this session compared against the previous one. And something that's in the manual that I don't think I mentioned last week is the role of kind of positive reinforcement. So where ratings have improved, it's really important that you kind of positively reinforce that improvement and find out and investigate and interrogate what was behind that change. And like I said, you might be able to identify resources or strategies that can be used across domains from the improvement in one domain. So once you've done that comparison, it's now time to select your areas to discuss in more detail. And we always recommend that you select up to 3. Never do over 3 because that would just be too time consuming. The conversation wouldn't go to the depth that is required. And so 3 is kind of the maximum number. And you select by clicking the actual kind of area title itself. So any blue text within the app represents a function button. So if it's blue, it means it can be pressed and it does something when it is pressed. So just to highlight it like this, can you see how job situation, friendships and medication are highlighted in blue? You do that by clicking on the title itself. So you would have to click here. If you press the scale on the tablet, that will take you back a step and you'll go back to the rating section. So you don't want to do that. You want to kind of proceed through the intervention and press the actual label itself. That will highlight it in blue, and then that sets the agenda for the remaining force of approach section of the intervention. We also recommend that kind of when this is newly introduced to a service user, when it's their first time using Dialog Plus, keep it as streamlined as easy as possible by only selecting 1 or 2 areas to discuss on the first session. If we try and do kind of 3 in that first session, it gets very confusing. They're not used to the process. So it's always better just to do 1 or 2 in the first few sessions. So once you've selected your areas to discuss, in this example, we've selected job situation, friendship and medication. You will then get this pop-up screen, which gives you the 4 steps and the kind of the purpose of those 4 steps, but also the questions that are part of that procedure. In this pop-up screen, you get a number of pieces of information. So you get here in the top left-hand corner, you get the area that's being discussed, medication. You get the rating that was given in this session. So this was a 2. So they're very dissatisfied. And you also get the steps here, step 1, step 2, step 3, step 4. These little I buttons here can be pressed, and then that takes you, the clinician, to the manual, which explains that step in much more detail. So that's just there as a kind of a helpful resource should you kind of need a reminder of what you're really trying to do therapeutically in this step. Like I said, in the manual that was sent out after the last session, there's more detail for each step in that manual, or can be found within the app on the I button. And just as a kind of a more general point, is even though one area has been selected to be discussed, so in this case, medication, the conversation that you have with the service user can bridge more than one area. Because in this section, the 4-step section, it's about kind of being holistic again, and to think about how resources and strategies can be used across domain. And exploring that interconnectedness is often key to that. So looking how the job situation is impacting on mental health, or how the job situation is impacting on physical health, which then impacts on mental health. These don't feel restricted to just discuss medication because that's what's selected. because they're often interconnected across the areas. And what I often say is kind of part one, the dialogue scale, is about breaking it down, is about breaking life and the context down into more manageable chunks so that you can have the beginnings of those conversations. And then the forceful approach is about building that back up and putting that within the context of their life and creating care plans within that context. So the scale kind of breaks it down, and then the forceful approach builds it back up again, and you see kind of across domains. The question that we get asked the most, probably, apart from kind of how do I download the app, is about the process of setting actions and about clinicians feeling confident enough to facilitate that conversation when often they don't know what the end point will be. If they're not setting the action, or they're not recommending an action, I think a lot of people can feel disempowered. A lot of clinicians can feel unsure of themselves about what to do and what their role is. So ultimately, the actions that are set as part of the Dialog Plus intervention should be brief and precise. And within the action, it should be very clear whose responsibility it is. And we say that because the actions that are documented are not just for the service user, they're also for the service or the individual clinician. It's as important that they're documented as well as the ones that are set for the clinician. And this is just all about accountability and, you know, showing that this is a kind of as much as we want the service user to come up with the actions themselves and to do those actions for themselves as part of this solution focused approach, there will be things for you to do as well. And just as a little aside, in the original trial that tested Dialog Plus for people with psychosis, before the trial, around 2/3, around 66% of the actions that were being set as part of the care plan were things to be done by the clinician. After Dialog Plus, this reversed, and around 70% of the actions that were documented on the Dialog Plus intervention on the care plans were things that the patient could do for themselves. So it is all about kind of empowering the service user to do things that they are capable of within their resources, identifying these resources, these networks, and helping them to achieve these goals, which will then in turn increase satisfaction with these different areas of life. Action items that are set can never be too simple. And it might be that one of the action items is for the service user to think about what actions they are capable of. That's absolutely fine. I think there's a tendency sometimes to try and set these kind of larger, bigger goals about becoming more independent, or, you know, about getting a job or whatever it might be. And actually, these kind of small goals that then build up into longer term, larger goals are much more important as part of this intervention. Where possible, the action should come from the patient, but often that is difficult for the patient to come up with themselves. So your role as the clinician is to kind of facilitate that conversation and suggest some things, but never kind of enforce an action on the individual. Actions should be always should be entered into the tablet on that forceful approach page in the pop-up screen, and they should always be reviewed at the next session. So at the very beginning of the next session, the first thing that you will do is to review the actions that were previously set. And this is not about kind of scolding them or you know, asking them why that wasn't achieved. It's more about exploring the reasons for it not being completed. And it might be then that you reset that goal in that session, or it might be that goal is no longer possible because of certain contextual factors, changes in their lifestyle, or whatever it might be. So you might then focus on something different that is achievable. So it's all about being, you know, Dialog Plus is the key word to Dialog Plus is flexibility, because it's always about kind of adapting and changing to the needs and context of the individual, whilst also having this underpinned theoretical model that has shown to be effective in improving outcomes. So shortly, we're going to split you up into 4 breakout rooms. There's going to be a Dialog Plus facilitator in each of those. I'm going to encourage you to use the worksheets that were sent out at the end of last session if you've completed them. Hopefully a lot of you have. If not, you can just think about the pilot delivery that you did, and think about kind of what went well, what was difficult, or what were some of the barriers in terms of delivering it, and finally, how could you improve your practice? Kind of what do you feel you could be better at? And we'll just kind of gently facilitate those conversations between groups. What I would encourage you to do is to kind of discuss more as a group and to use your clinical backgrounds and experiences to kind of make those conversations more in depth. And really think about, like I said, really be honest about what those barriers are. It might be that you're super keen on doing it, but you just don't think you'll have managerial support or the time or resources to implement it. And that's absolutely fine. That's something we'll discuss as well. So we're going to move the conversation from thinking about what you did when we were piloting it with friends and family, and then applying that knowledge then to implementing it within the clinical services and what the differences and challenges might be. Before we go to the breakout rooms, I'm just going to give you an opportunity to ask any questions that you might have. I tried to cover some of the frequently asked questions in that overview, but is there any questions that anyone has right now that they think would be beneficial for the group to ask about the background, the intervention, the technology, any of that? If not, we can save it for the breakout rooms.